Recovery of function. This is the final and important stage of healing for any tissue tear or disc involvement in your back, and it must not be overlooked. After any derangement or cut in the disc from a bulge or herniation, it is critical that we assess that scar tissue. When you have a cut, you initially would avoid bending it. So like, let's say there's a cut on your finger. You would avoid bending it to reduce the stress on that cut so you allow the scar tissue to form. After a few days, you would want to then test the integrity of that scar tissue to see if it's strong enough to bend. For you want to begin bending as soon as that scar tissue has some integrity so the scar tissue is flexible, heals flexible. If you wait too long, adhesions may form, or the scar tissue will get so tight that you would have difficulty, even pain, when you bend it. This would be the same in your back after any derangement or cut in your disc from a bulge or herniation. So initially, the treatment for that disc herniation or disc bulge would be to avoid bending or stressing that cut. So most of the time, the cut is posterior, and the stress that would aggravate it would be bending forward or slouch sitting. If the cut's anterior in the disc or to the sides, then the opposite motion would aggravate them. Now, the recovery of function prevents this scar adhesions. So this is why it's so critical not to miss this, because, again, it will mimic your original symptoms, and you need to be reassessed to see what the true cause is, and a lot of time that's overlooked. So if we stress that scar tissue at the right time, we're going to avoid it adhering. So when is the proper time to stress that scar tissue? Because we can't see it, unlike a finger. Well, the proper time is when you're symptom-free for a couple days. So if you have no symptoms for 3 days, you then want to test. And that will be, if your exercise was bending backwards, the opposite motion is going to test that scar tissue. Will be bending forward. So we always start with baseline. You're going to first check all your motions, bending forward to touch your toes, bending backwards and side to side. You want to make sure you have full pain-free motion. And then what we next have you do is sit in a chair, and then you're going to bend forward, repetitive bending and sitting, getting your head all the way down and through your knees. And then you come all the way back up as a check, because we don't want you to miss any pain on return. You're going to try that 10 times, and then you're going to retest your baseline. What we're doing is we're testing the integrity of that disc. Is that disc coming out as we bend that scar tissue? If it starts to come out, you're going to lose motion in the opposite direction. So that jelly is going to come backwards, and then when you try to lean backwards, you're going to be a little bit tighter or pain. The loss of motion precedes pain. We also then want to check side to side. If your motion's still full, then we want to go on to the next set of 10. We want to check it a total of 5 sets of 10 or 50 times. If your scar tissue can withstand 50 bends, then it's strong and stable. If we reproduce this, if we start to get tightness, not necessarily pain, but some loss of motion or tightness in the opposite direction, then your scar tissue is not strong enough for full recovery of function. And we want to take a step back. So after 50 times, at each set of 10, you're rechecking your baseline motion. If you can go through all 50 times, then you're fully ready for recovery of function. Get back to doing everything you used to do. We're going to continue with some forward bending once or twice a day. Avoid the early mornings, followed by a little bit of extension. So you just want to make sure that back stays healthy. That scar tissue will continue to get tighter over the next couple months. So just for about 2 months, you want to make sure that it's nice and flexible. And for the rest of your life, if you're doing a lot of slouching or bending, you always want to do a bend backwards. If you didn't get through the full series of 50, you only got to 30, and you start to lose some motion backwards or motion sideways, then you know what? The scar tissue is not quite strong enough. Let's wait another couple of days. So let's wait another 4 days and then retest it. But again, you don't want to wait too long because you don't want to get adhesions. If you had been symptom-free and all of a sudden your symptoms are returning, you should contact one of our specialists to double check, is it from an active disc or is it from scar tissue? Because the treatments are completely opposite.